With as cold as it's been, a local burn unit has already had more admissions of people with frostbite than all of last year, and the winter season is not over yet.
They are, however, able to give those in danger of amputation from frostbite some new hope. Fox 8's Dave Nathers explains.
This has been a brutal winter, even if you look no further than Akron Children's Hospital's burn center.
Yeah, we've had more patients come in this season than we have had all of last season, and this season's only partway through.
All with frostbite from exposure to the bitter cold.
Ultimately, if there isn't enough blood flow long enough, particularly to the tissues as well as the bones, the soft tissues and the bones will die, and that's not recoverable. I mean, the concern with frostbite, if we're not able to save those extremities, is that they have to be amputated.
Akron Children's Hospital, however, is one of only 2 in Ohio using a drug just approved by the FDA called Iloprost, a drug that dilates vessels returning blood flow to damaged tissue.
By giving Iloprost, we've been able to completely change the game in terms of frostbite and the resulting amputations. The number of amputations we've had to do this year is dramatically less, and the number of patients we've had with concerning injuries is dramatically more.
In the FDA study for the approval of this drug, 60% of those who were not given Iloprost remained candidates for amputation. 19% of those who were given Iloprost along with something else still remain candidates for amputation, but 0% of those who were given Iloprost alone needed an amputation.
I can't tell you, it's too early to say what that percentage is, but I think we're creeping up higher, closer to our goal, obviously of 100%, but I think we're creeping up into that 80-90 range now.
Frostbite is something that is completely avoidable, properly dressing for the conditions and warming up indoors when you feel too cold. But for those who cannot, for whatever reason, this new medication is described as a game changer.
And what we're seeing is a dramatic change in what we would expect for these patients in terms of their amputation risk. And I think, our whole mission is to save limbs and lives.
Dave Nathers, Fox 8 News.
Dave, thank you. So one other unique property of this medication is that it can be successfully administered as long as 72 hours after a patient seeks treatment for severe frostbite.